how do we get it under control? Dr. Jen Caudle is with us once again. She's got more on this surge. Always good to see you, Dr. Caudle. You know, we hear these startling numbers. It's, I think, kind of what we expected. But are people really hearing the numbers? You know what I'm saying?
I do. And I'm not sure. Holly, that's a great question. I'm not really sure. I don't know if as a nation we're fully internalizing what this means. And I think that's what you're asking. You know, we've literally just crossed 100,000 cases, new cases on Wednesday. This, months ago, this was unheard of. Not only that, we've surpassed over 230,000 deaths. This is, it's incredulous. It's unbelievable, and it's tragic. And yes, I'm not sure that as a nation we are fully internalizing what that means. That means there are neighbors that we have, family members, friends, coworkers, colleagues, distant relatives. Everyone at this point probably either has been or will be touched by COVID. And no, I'm not convinced that we're internalizing this the way that we should, that we're always taking it as seriously as we should either.
You know, I think pandemic fatigue is a real thing, right? And people just, they want to speak it into existence. They want everything just to go back to normal. But these new numbers that come out, people really do need to understand. We're not just talking about people testing positive, but on Wednesday, 17 states, including Virginia, by the way, had the number of hospitalizations go up. So the number of serious cases is also increasing, correct?
That's right. And not only that, but deaths are increasing now as well. We have to remember how, COVID-19 and so many other conditions work, right? The cases are first. People get infected, and that's what we call a case. And then as time goes on, if cases get more severe or people don't get better, that's when hospitalizations go up, because some people will unfortunately need hospitalization. And then that's after that we start seeing deaths, unfortunately. So you're right. As we get more cases, it inevitably means, likely more hospitalizations, which we are seeing, and more deaths, which we're seeing as well. We're also seeing in certain parts of the country, if you remember back to March and April, in the beginning of the pandemic, we were seeing hospitals being sort of overwhelmed. This is where the concept of flattening the curve comes in, right? Mm-hmm. Because the concept about flattening the curve really is about keeping our cases underneath a threshold for which we can actually manage them, amongst other things. Now we're getting to, in some places in the country, where hospitals, are running out of ICU beds. They're running out of supplies. They're running out of room. This is a big problem. And also, as you mentioned, this pandemic fatigue, we can't become fatigued.
Do we need to shut down again? And if so, for how long?
Yeah, that's the $1 million question. Let's be clear. No one wants to shut down. I don't want things to shut down. I don't think anyone in this country wants things to shut down. We also know, in addition to this COVID pandemic, we literally have also a pandemic of sort of the after effects, right? Millions, well, I shouldn't say millions, but many, many, many Americans have lost their jobs or are facing financial hardships or other ramifications from the shutdowns. However, something needs to be done. We need a national strategy, which we still don't have. There's not a national coordinated response. Every state and city and locale is sort of doing their own thing, which in some cases probably makes sense. But we do need a national coordinated strategy. I also think that we need a national mandate. That's something I think we need a mandate for. Can we enforce it all the time? Probably not. But it still sends a message that this is important. And honestly, Holly, in some cases, there are probably some regions that need to pull back, whether we call it a shutdown or we call it something else. Yeah, do things need to be curtailed? Do we need to limit the number of people in certain spaces, et cetera? Absolutely, because we know that works. And so we likely will have to do that in some regions, in some places, at some time.
We only have about 10 seconds left, but is the bottom line that this really is our life until a vaccine exists, whenever that is?
Honestly, I think we're going to be wearing masks and pulling back even when we have a vaccine. Remember, just very quickly, not everyone will likely get the vaccine, and vaccines are not 100%. No vaccine is. So to be honest with you, we're going to have to live in this space for a while. That's why we can't get tired. Wear your mask, social distance, wash your hands, stay out of crowds. These are very important.
Sage advice, Dr. Caudle. It's why we always go to you. Thanks so much. Appreciate your time.
Thank you.